dental implant placement on number 7. This procedure shows the placement of an implant direct implant at number 7 area. The ridge here is adequate for a 4.2 by 13 millimeter implant. To view the exact size of the bony ridge, we will reflect a flap starting just lingual of the crest of the ridge. This allows the flap to cover the implant. We start with a surgical bone burr in the high-speed handpiece to establish a pilot hole. Next, we follow with a pilot drill in the implant slow speed. Then we follow with the smallest implant bone drill, the 3.0 by 13 millimeter. Next, we place a length indicator and take an X-ray. This indicates the direction and length and allows us to change the direction or angle. In this case, we will change the direction more toward the mesial. Then, change to the next larger drill, which is a 4.0 by 13 millimeter. We place a 4.0 by 13 length and angle indicator and take another X-ray. The X-ray shows a more ideal angle, equal distance between tooth number 6 and number 8. We continue drilling until we reach the desired length, which is 1 millimeter below the bone. We take one more X-ray to verify the length. The X-ray shows an ideal length and angle. The implant is placed on the handpiece with the appropriate attachment. Next, we take a ratchet and continue insertion until we reach the desired position. Then we take the hex wrench and remove the attached abutment that came with the implant. Next, we place the enclosed cover screw. It comes with an extension, but in this case, we will not use it and use only the cover screw because the tissue flap will cover over this area. Then, the tissue is sutured and the patient scheduled for a suture removal and for a post-op check in 1 week. Implant number 7 and flipper. Tooth number 7 is missing and will be replaced by an implant. Before the implant is placed, an alginate impression is taken of the upper arch, and a posing is not necessary. The impression is poured up with plaster for easy removal. A denture tooth is used to replace the missing tooth. In this case, we will use the denture tooth to make a mold for the acrylic composite tooth. The tooth is held in position with red wax. By registration material is used to make the mold. This will be used to make the composite tooth. A separator is used on the model before applying the acrylic. Liquid and powder acrylic is applied to the model and a small amount in the missing tooth area. Placed in hot water until set, about 5 minutes. It can also be placed in a pressure cooker for curing. The area under the missing tooth number 7 is roughened with a diamond burr to increase adhesion to the composite. Composite bond is added to the area. The mold is placed against the facial of the model. Composite is added in increments and light cured. A microbrush with bond is used to apply and smooth the composite. Composite is used because we can add to it, reshape it, grind on it, change the shade, and so forth. It also adheres well to the acrylic. Diamonds are used to smooth and shape the composite tooth before removing it from the model. Then the flipper is removed from the model and smoothed and shaped with acrylic burrs and a slow handpiece. Rag wheel and medium pumice is used to polish the flipper. The patient will return in the afternoon for delivery of the flipper. It will be adjusted for proper fit. Then the patient will return in 1 week for suture removal. Delivering the flipper number 7. The patient returned in the afternoon to deliver the flipper for number 7. It is now ready to deliver to the patient. It is tried in the mouth to check for high spots at the extraction site. PIP, or pressure indicating paste, is brushed on the tissue side of the flipper and placed in the mouth. The high spots are removed with diamonds or acrylic burrs. This is continued until the paste does not rub off when applying pressure. The tooth is shaped and polished. More composite is added as needed to achieve the desired results. The body is checked with articulating paper and adjusted for minimal contact. In this case, we obtained a perfect tooth shade and a nice shape. The black suture will be removed in 1 week. Impression for crown on implant number 7. The patient has returned after about 2 months for osseointegration to take place of the implant at number 7 area. The tissue has overgrown the implant. A diamond burr is used to remove the tissue. The cover screw is removed. The abutment is placed on the implant. Cotton is placed in the abutment to keep impression material out. Impression is taken and the abutment is removed and placed in the impression and sent to the lab. The abutment will be returned on the model with the new crown and placed on the implant. The crown will be cemented on the abutment. A screw-on implant crown may also be used without an abutment.